Everybody, I'm so excited. We're here with Jodi, Barth from the Center for Facial Recovery. I'm just going to get her to join here on the call. This is Bell's Palsy Talk. I'm Barbie. Hooray! Good morning.
Good morning.
How are you today? I know it's about 11 o'clock there, 10 o'clock for you.
Yeah, I'm good. It's a beautiful sunny day.
Excellent. Thank you so much for joining us. We have a bunch of people here coming on to the call. Thank you so much, everybody, for coming on. I know everybody's really been excited about this talk, and of course I am. We've been trying to get it organized now for a while. So I'm going to introduce Jodi while we have everybody kind of coming on, because I don't want anybody to miss any questions or anything. So Jodi is one of a handful of recognized facial palsy therapists in the United States. She's a licensed physical therapist with 40 years experience in the field of rehabilitation and a specialization in outpatient rehab. Her wide range of clinical experience has provided her with the tools to perform in-depth, comprehensive physical therapy evaluations and treatments using dry needling, which I'm very excited to hear about, graded motor imagery, biofeedback, and extensive manual therapy. She's a sought-after speaker nationally and internationally in the areas of facial palsy, of course. And Jodi is a published author, as we know, of the wonderful book that I love, Fix My Face. And she has a special interest in the use of diagnostic ultrasound for facial palsy, early eye weight loading to minimize synkinesis, and the use of mirror book therapy, and multiple other articles. So I know our followers have so many questions, but let's get started. Why don't you tell us a little bit more about yourself or your passion? And what I'm wondering first is how you decided to specialize in facial palsy after all that education and experience.
So that's an excellent question. For many, many years, I was an orthopedic manual therapist, really specializing in the spine. And I was getting patients better. They were recovering, but there was a piece missing, especially for patients that had neck headache issues. And so I started focusing on the jaw area, because the jaw is directly related to what happens in the upper cervical or the upper neck area. And one day I had a doctor call me who referred me many patients and said, "You do something with the face. Do you know anything about facial palsy?" Now, this was going back now probably 18, 19 years. And I was like, I mean, in school, I graduated 40 years ago, and the only thing they taught about for facial palsy is they probably gave us an hour lecture and then taught us how to use electrical stimulation. And I was like, okay, because 20, 40 years ago, that was like kind of the only thing that they were telling you to do. And so I said, well, let me take a look. This patient happened to have had facial palsy secondary to an acoustic neuroma. And so I did some research, which, as all of you know, is very hard to do. There's not a lot of information out there.
You're saying, right? So,
right.
So even less. Yeah, there's not a lot out there.
There's not. There was a therapist, or there is a therapist named Todd Henkelman, who was out of Pittsburgh doing a lot of work with facial palsy patients and TMD, or jaw pain patients. So I connected with him, and he kind of was like my initial mentor of teaching me the foundations of treatment of facial palsy. And then I combined that with my skills as a manual therapist, because yes, I always felt that facial palsy is a nerve problem, but there's also always muscle involved when there's a nerve problem, that the the muscle tissue becomes abnormal after it doesn't get the proper innervation. So I started combining my two passions, and ever since then, I just have had such joy working with facial palsy patients. One, because I feel that patients who suffer from facial palsy are so appreciative of anybody willing to try to help. And I have seen in my 40 years so many different patient diagnoses, but facial palsy patients come into my clinic and say, how can we get me better? They don't say, how can you make me better? Yeah. How can we make me better. And that it's been a wonderful, wonderful experience. And, you know, every day I learn more and more from my patients every day. So everybody comes in, teaches me something. I try to include that into my new treatment regimen. Anybody who kind of looks at our videos on our page will see that I'm constantly changing things, because what works for one person doesn't work for another. And so I'm trying to just, you know, I'm finding the best situation.
Yeah, and that's what I do resonate with that, because that's what I'm like with myself. And I do love in the book, one of the sections that I love the most is just like worth a shot, you know, the things that are kind of worth it to try. And people ask me all the time, oh, well, did you try this? Did it work? Well, did you try this? Did it work? Well, maybe, but I'll tell you, first of all, like say acupuncture. Yes, I am one of those people. I do think it helped. Do I know if it made a difference compared to if I hadn't have done it? No, because I did it, right? So all of these things that we can do that are worth a shot, that aren't going to hurt. I feel like people with facial palsy are like, oh, let's do it. Sign me up. So yep. Yeah, that must be very rewarding for you as a therapist, especially because like you're saying, there's not information out there. So any research or something that you figure out must be so rewarding if it works for somebody, or gives them hope or anything like that. I definitely know that would make a big difference, you know, in my life. I do have synkinesis, so of course I have questions about that in a bit. Now, why don't you tell us a little bit about the diagnostic ultrasounds, and because that's new to me, and the early detection of synkinesis, because I do like to talk about that a lot with the followers. I'm about 6 years in, and I definitely push too hard, and you know, I'm a solutions girl, so you know, I've talked about before, it's like, oh, I gotta do stretches, okay, we're gonna stretch the face, you know. And I definitely think I didn't do myself any favors there. I do think that's a very common thing, you know. And regardless of whether the physical therapist says take it easy, you got to go slow, that's not our mentality here, especially in this culture. And it's also not like the other muscles in your body. So I'm very interested to hear about the ultrasound techniques, what that includes, what it involves, and then the early detections of synkinesis as well.
Okay, that sounds great. So diagnostic ultrasound is for any of you who've had children, you know what diagnostic ultrasound is. You're looking at the fetus, you're looking at development. You can use diagnostic ultrasound on multiple areas of the body. When I first started treating patients with facial palsy and I was feeling the tissue, I knew something didn't feel normal, but I didn't understand what it was. So we worked with a doctor who was an expert in utilizing this technique of diagnostic ultrasound. So ultrasound is taking sound waves, pushing them into tissue. The sound waves get reflected by bone and then give you an image. And so by using the ultrasound, he showed me that deep underneath the skin, that the muscles were surrounded by kind of this fibrosis or thickening of the tissue, which many of you experience. Like in this SMAS area, you'll feel it underneath the lip, underneath the top lip.
Yeah,
all of them
is way thicker, especially if it's tense or whatever, than this cheek before I did it. For people like in here, is way thicker. That's what you mean, right?
That's exactly what I mean. And so when you feel it, like when you feel this corner versus this corner, you can feel that thickness. When you flip your lip up, you can feel like tightness a lot of times underneath your top lip, same thing under your bottom lip. So when I do ultrasound and I look at the picture, especially on initial evaluation, no matter where you are in your recovery, I do a diagnostic ultrasound initially. So I look at your non-involved and involved side. So if you are acute onset, then I'm looking to see, is there any muscle activity? Because what you do is you can look at how the normal muscle moves on the uninvolved side, and then you watch it. And this is in real time. That's what's so nice about ultrasound. It's in real time. So you're trying to smile, and I'm looking to see if the muscle's activating. So sometimes we see muscle activation, and sometimes we don't in the acute phase. You know, and again, we're going to keep watching that. We can also use in those stages, if we see a little motion, we can use the ultrasound as a biofeedback tool so that you can see how it looks on ultrasound on your non-involved side. And then, okay, wait, what do I have to feel? What do I have to change to make it seem like I'm getting activity on my involved side?
Right.
One excellent usage of it. The other is to see whether or not there's this thickening of tissue that is developed. What happens throughout the body is when you don't move tissue, fluid increases in the area, because the way we get rid of fluid in the body is through muscle activity. Right. And so if the muscles aren't activating, that fluid like sits there. So that's why a lot of times you feel like it's thick and swollen even. And that's because the fluid is sitting there. If you don't do anything about it, that fluid thickens up and causes the fascia, which is like the lining around the muscle, to thicken up and almost scar down on the muscle.
Yeah, that's what I say, almost like scar tissue-ish, right?
Exactly. So when you look at this on ultrasound, let's say this is how your masseter muscle looks, right? So the space between my hands is the way the masseter muscle looks. On ultrasound with the facial palsy, it looks like this. And that's because the fibrosis has conflated the tissue. It's kind of like making it so that this poor muscle can't move. I describe it to my patients as if you put your elbow in a cast, right? And then I'm asking you, okay, now straighten your elbow. You can't do it. And that's what you can see under ultrasound. You can see that the muscle is trying to move, but it can't, because in some cases you have this fibrosis going on. So that's another way I use it. The last way, which is more of that we've added probably over the last 5, maybe even longer, 7 years, is picking up early synkinesis. And so what I do is I monitor, again, during your initial eval and then throughout when you're in that acute recovery, is I look at the mouth and I have you close and open the eye, because that's a pretty typical synkinetic movement, an ocular oral synkinesis movement that's occurring. And so I look at the mouth to see whether or not we have any small contractions while you're doing that eye closure. Okay. If I see that, and a lot of times what research has shown is that the longer it tapes or the more ineffective your eye closure is, the higher chances of you developing these abnormal nerve connections. So if I see that the mouth is moving, then I will speak to the physicians involved in the case to talk more about, say, a little more aggressive treatment of that eye closure. So our doctors utilize filler, and they put that in the upper eyelid instead of using like surgery for a weight. They put filler in the upper eyelid. They'll put 2 little stitches in the corner of the eye that helps to close the eye better. And then what you'll see is with better eye closure, that synkinesis of the mouth decreases. So we want to kind of jump on that quickly. And that's why initially, you know, it's all about the eye. And I say to patients, I really want to get your smile back. And your smile is important to me, but it's all about the eye, because the sooner and more effective I get that eye closure, the less the synkinesis or the abnormal connections are going to be formed. Another area that we look at with ultrasound for synkinesis is actually this platysma area. A lot of you have tightness in that neck area. You know, you could feel it when you go into your smile or your pucker, or, you know, trying to pull your lower teeth down. And you, patients describe it, they get cramping, especially when they do a hearty laugh, or when they're like looking up in the shower, get cramping. And so that's that platysma muscle. When I'm looking at that under ultrasound, I am asking patients to attempt to smile or pucker, depending upon where they are in the recovery. And I look to see whether or not that platysma is showing signs of synkinetic movement compared to their uninvolved side. If it is, the newest thing that we are now doing is I'm sending them to the docs and doing early Botox to that platysma. So the minute I see synkinetic activity of that platysma, we're recommending Botox. Now, you don't want to do Botox in other parts of the face that are trying to regenerate, because Botox will decrease the ability for the nerves to regenerate. The platysma, though, is a muscle we really don't want to regenerate. The platysma does nothing for us functionally. I call it the appendix of the face, because it's just, it becomes a pain and it's useless. And so if we can decrease the formation of those abnormal connections from the platysma to the mid part of the face, that also will help with facial recovery.
Eliminate kind of one issue.
One,
yeah.
And the platysma, just a quick anatomy lesson, the platysma muscle goes all the way from below your collarbone and inserts into your mid face.
Oh.
And so think about all of these muscles. If this platysma is tight, all of these muscles, like your smile, your pucker, your snarl, are all being held back because this is pulling down. This is not letting it move. So we're trying to kind of release that. So this part, this from your jawbone to your cheekbone, has better freedom of movement.
Allowing to do it. Now, when you say, okay, so you're keeping an eye on all these things, what time approximately are we? I know everybody's different, but approximately right now, you're like a month after onset, 2 months, 6 months. Is this something that's down?
So again, the sooner that we see patients, the better it is, because we can do the ultrasound. It helps us understand where the patient is in the recovery, which also helps, and this is a whole other talk, helps us break up what the diagnosis truly is. Is it Bell's palsy? Is it Zoster-Sin-Herpeti? Is it Ramsay-Hunt? Which then changes maybe our medication regimen, all of that. But synkinesis we start seeing as early as 6 weeks.
Okay.
So around that 6-week time frame is when I would be really looking under ultrasound to see whether or not I see any of this abnormal development occurring.
So up until 6 weeks, you kind of recommend like chill out, relax.
No, I'm not a chill out and relax therapist. I know a lot of people kind of say, just wait and let it heal. This is where my orthopedic brain comes in. You would not, in any other part of the body, would you say, don't use it, you know? So you don't want to be aggressive, but things like gentle massage, lymph massage, things that help to move that fluid around that we were talking about, that is sitting there because you don't have active muscle activity, is very important to do on initial. So our protocol with our clinic and our physicians that we work very closely, the sooner the better. Because then we could teach you some gentle massages, this lymph massage. And again, getting back to it's all about the eye. Because initially, no matter what your diagnosis is, if you're not closing that eye well, then we are recommending an external eyelid weight that's called a Blinkies that you can put on that would help to close the eye from the top lid down. And then we teach a taping technique that tightens up the lower lid and brings it up. because even though 90% of eye closure occurs from the top lid down, that 10% from the lower lid, that lack of tightness, is what prevents you from doing a tight eye closure, a successful blink, you know, allowing the tears to fall out because, you know, you don't have that successful reabsorption. So that's what our initial treatment is about. It's monitoring, gentle massage, lymph massage, and eye care.
Gentle, gentle, gentle. Yeah, like moving that fluid. Now, someone just asked, where do you find Blinkies?
So you need a prescription from a doctor to get the Blinkies, but they're online, and you know, people could email me and I can give you the link for the Blinkies, and then you can connect your doctor to it. The issue about Blinkies, they come in different weights, right? So you really need to be fitted properly for the right size weight. One of the things we do through telehealth is that we can assess you, and I get an idea of, you know, what weight, based on how your eye is closing, of what we should try to get you to start with. And then we can help you with having the doctor order the weight. It goes to your house, and then we can instruct you how to use it and see how it works.
Okay, so you kind of led into my next question. So obviously the center is somewhere where everybody watching this right now is like, sign me up, how do I get there? But obviously we all can't. So do you do virtual appointments?
Yes. So way before COVID and before telehealth was the in thing, I had been doing telehealth or video conferencing with the patients, because there are so many patients that are not in the Washington, D.C. area that can't get to us. And I feel like I can give you at least a good 70% of what you need to do, talking you through exercises, stretches. Because I've touched so many facial palsy patients in my life, I know the areas most likely that you'll feel the thickness and what I'm looking for. And yeah, so it's easy for me to say to you, okay, let's put your thumb inside your cheek. And what I want you to do is find that space between your cheekbone and the corner of your lip. And there's a muscle there that's called the buccinator muscle, right? And the buccinator, I'll just go through this because I think this is really cool, and this is kind of one of my new things that I've been doing with patients because I feel like it's been really effective. So the buccinator muscle's responsibility is to suck your cheeks in. So when you go into your pucker, the pucker itself is done by the orbicularis oris, the muscle around the lips. But you need that buccinator to come in for things to become in midline and not askew to the non-involved side. Right? So if that buccinator is not working, or in the case of what I am seeing under ultrasound, or is filled of fibrosis and can't move, it's kind of like you're pinching, and it would be on the inside of the cheek, but you're kind of pinching here, and then you're trying to pucker. And that's what happens, right? So one of the techniques that I am teaching my patients is you're going to find where your masseter muscle is, which is your chewing muscle. So you would bite down and you'd feel this muscle right here, right? As you bite down, you kind of feel it tighten up. And then you feel the corner of your mouth. That's where the orbicularis oris is. And then the buccinator is kind of halfway in between that area. So kind of there. And when you poke around, you're going to find like a thickness, even like a tender area in there of that buccinator. Right? Do you feel what I'm talking about?
Yeah, like it dents in a bit.
Yes, exactly. So what you're going to do with that area, now think about going back to what I said, the ultrasound, that the tissue is conflated, meaning that it's kind of lying down on each other, and I want to open it up. So think about you're using your hands to kind of give you space and open up this tissue. So you'd be pinching on the outside, okay, and with one finger, you'd be massaging on the inside to kind of loosen that up.
Mm-hmm.
You feel that?
Yeah.
And that'll help loosen up that buccinator. When you loosen up that buccinator, it kind of opens up more independent activity of the muscles around the mouth. And what's really cool about this is as this mouth muscles start becoming more independent, that eye connection becomes less and less. And that's why my thought process is, yes, synkinesis is an abnormal innervation of the nerve reconnecting to another nerve. Okay, I agree with that. But the other issue is this musculoskeletal component where everything is interconnected and nothing can move in isolation, because it's like it becomes like a spider web in there, and things can't move independently. So if you have a tightness here, right, and you're trying to move and it's a tightness, the eye comes in with it. Yes, it's an abnormal connection.
It's because
right.
Already feels looser for me, but also I'm noticing just in the video, that my eye, and it's not as active. That makes sense. And I did read, and I think, I hope I quote this properly, but I did read a couple days ago just what you were saying, that synkinesis is there, but it's a majority of it is just the tightness of everything in your muscles, and you think about any part of your body, it's just like all the time. Well, that makes sense.
Yes.
Now, so one of the big questions that I've been getting from people is, okay, so synkinesis, and this is very, for me as well, very selfish for me as well, because I'm about 5.5 years in now. Is that too late? What would people?
I'm gonna share a really cool story with you guys, okay? And I am not saying I'm a miracle worker. I'm not saying that at all. I never tell patients that I can cure synkinesis. I can't cure synkinesis, but I can make it better. But I have this patient that we've been seeing for probably 16 years with facial palsy. One of the hardest things for her to do was to roll her lips in. She couldn't roll her lips in, and the attempt of rolling her lips in fully shut down her eye. So the other day in the clinic, I used our diagnostic ultrasound. I saw that her buccinator, that muscle that we just released, had so much thickness and tightness in it. Now, this is where my needling, my synkineedling comes in, because so many people are familiar with dry needling, which is similar to utilizing an acupuncture-like needle, but instead of doing it to change energy flows, what the dry needling is for is to go in and break up what are called trigger points in muscles. So when muscles are really tight, like when you have a trigger point or a spasm in your neck, you'll do the dry needling to it, and it kind of releases the tension. Well, in the face, we don't have trigger points. So if anybody says, oh yeah, I could dry needle your face, that's not the concept that we need. There are no trigger points in your face, because you don't develop trigger points in your face. You develop this thickness of tissue, which is from what everything we said. But I use the needle and go in there and kind of debride the tissue. So I kind of poke at this tissue that's like this, and I kind of poke holes in it and holes in it and holes in it, so that cast that has developed over it allows the muscle to move and open up. And so at the end of our session on Thursday, this patient, after 16 years, could roll her lips in and had a very little amount of synkinesis of her eye. Now, this was like unbelievable. Like, this is like, therapists live for these days, and this is like one of the most special days in recent professional life that just put me over the moon. So I'm not saying that's going to work for everybody, but that's kind of how we work on this. And so when I talk about this, and then my colleagues are saying, no, it's a nerve problem, I'm like, it is a nerve problem that it starts with, but then all of this neuromuscular that we cannot ignore. So the whole thing of massage and stretching has to be a very, very important part to make your neuromuscular re-education successful.
And I do, you know, we were talking about my friend Reem on just the other day that also too, all the little tiny muscles get tense for little tiny reasons, stress, cold, who knows what. And so they're constantly, even on the sound side. So, you know, all those little tiny movements that you're doing for a year, 2 years, 3 years, 10 years, 16 years, of course, that's gonna, you know, even from an, no, not a highly educated mind in this, I just have experience, but, that makes sense to me that you would have the little holes and pull it. And that is such a fabulous discovery. And that's awesome. Just all these different ideas that you guys are doing and trying. And obviously your patients are totally on board. Like I said earlier, like, let's give it a try. Like, you know,
Give it a try. Yep. That's it.
Awesome.
You know?
I'm so excited to hear that. So someone who has, you know, onset synkinesis like myself can contact you and see you virtually. And that, so that's through the Center for Facial Paralysis. Of course, I will post all
recovery. Center for Facial Recovery.
Facial Recovery. That's right. Center for Facial Recovery. Let's make sure we get that right. And so Center for Facial Recovery. And you also have a foundation. Now, I wanted to hear a little bit about the foundation helping others.
Yes, so we formed this foundation because we felt there was a lack of research and resources for patients. And so the nonprofit foundation was started by actually a generous grant from the Marriott Foundation. And so we were able to start doing research projects. So the research about the ultrasound is one of the researches we have put out, the research for the eyelid loading to decrease synkinesis, multiple papers that we put out. But the most recent, which was also from a very generous grant from the Marriott Foundation, was the Fix My Face book. And that was something in the making for probably really 8 years, to try to get a resource that patients could just pick up and say, okay, now I understand this. Yes, thank you. But
picture that you guys picked as well. So cute. And I am going to interrupt you because there is somebody on the feed that said they're wishing there's more information with Ramsay-Hunt syndrome. Now, you guys do work on Ramsay-Hunt syndrome as well. Now, of course, I'm focusing on Bell's palsy just because that's where my experience is and what my feed is. But Sharon on here, make sure you get this book, Fix My Face. We will post the links. I have them posted on a lot of my posts, and it does have a lot of very valuable information about Ramsay-Hunt. So just people listening, it's facial paralysis.
It is facial paralysis, and that's what I want to clarify.
Okay. Yeah.
So Bell's palsy, it is a general term that medical professionals throw at you if you have facial palsy, right? Okay. It's very generic. Okay. It's kind of saying like you have neck pain. Well, do you have neck pain because you have a disc problem? Do you have neck pain because you have arthritis? Different things. What we found is if you truly had Bell's palsy, the definition of Bell's palsy, which is more likely, and the research is still not there, more likely from more like the herpes simplex 1 virus, which is like what gives you cold sores, or possibly not even from a virus at all, believe it or not. There's research that shows it. Those are the patients that you read about that get 75, 60, between 68 and 70% of the population just gets better, right, with facial palsy. Those are Bell's palsy patients. The rest of you that have not recovered that way have one of two things. One is called zoster-Sin-Herpeti, which is basically Ramsay-Hunt without the shingles eruptions. So it means it's a herpes complex virus that has attacked your nerve. So you've had heavy-duty virus attack your nerve, which has caused swelling and a lot of inflammation to the nerve. And those of you that have the diagnosis of Ramsay-Hunt is an easier diagnosis to make because you will see those eruptions, right? You'll see like eruptions on the tongue, in the ear, or a lot of times patients will have like a very red swollen ear. Though I've had patients go and the doctors totally misdiagnosed that too, which is, another reason why we wrote this book. So for the patient who's asking about Ramsay Hunt, this is all for you. For the patients that have not fully recovered, this is all for you. For typical Bell's palsy patients, you're going to be better in 8 to 10 weeks. If you're not, by that 3-month period, completely better, in my world, you probably didn't have Bell's palsy, but had more this zoster syn herpeti. And therefore, from a treatment standpoint, should have been or should be treated more aggressively with antivirals, not just a 10-day course or a 7-day course of antivirals, because this is a heavy-duty virus that has attacked your nerve. And so our patients go on antivirals for at least 3 months, sometimes up to a year.
I was wondering, okay, so for myself, I haven't fully recovered. I'm probably about 85%. So I didn't have the outbreak in my ear. So then that's that. And so, yeah, I was thinking that. I'm like, I obviously didn't take the antivirals long enough, or the steroids from reading the book. I only had, I think it was maybe a week of both.
Right.
So, obviously shoulda, coulda, woulda, but that's
right.
why.
And that's, that's one of those things. And that's why we wrote the book, to try to put people at the front and take it to their doctor and say, okay, this is what you're supposed to do, right? Yeah. Because we've tried reaching out to physicians and doing courses for physicians, and really nobody really, I don't want to say nobody cares, but most doctors, or a lot of doctors, will say you're just going to get better. And if you don't get better, it is what it is, and that was not acceptable to us. So
and also too, because, I mean, doctors are human. So you want to say, okay, well, 90% of the people that come into my office have this, that, or the other thing, or cancer, or things that are really affected. So if I only have, I try to get around to have my extra education and continuing education, which I know all doctors do, amazing humans, that you're going to, I would assume, spend the time in areas that affect most of your patients. And so, I can understand that, where it's like, okay, well, I've only ever seen maybe 1 or 2 people in my career who have, this. And then, so that's where I'm super excited and passionate. And I love how our passions come together, because I'm a talker, and that's my passion, is to share information and make people feel like they're not alone, and connecting them with people like yourself to be like, hey, I have this thing. I heard Barbie talking about it, or hey, I used to have this, go talk, go here. And that's what I'm really enjoying, especially about social media. It was 5-6 years ago for me. Of course, what do you do? First thing you do, Google, and all the same information. Now I was very lucky to see a physical therapist here in Vancouver, Susan Rankin, and she's lovely. Now for me though, it was so frustrating for me. I, of course, was just saying to my husband last night, obviously now learning more about synkinesis, I'm like, I can't believe I didn't stick with it. She was amazing, so knowledgeable, so fortunate to have somebody so close to me. And I just was so frustrated, because like you're saying, the little tiny muscles, it's so overwhelming. So, that's where I do try to share that part too, that for people, it's okay that, you're like, oh, and you give up for a bit, you can go back, you can try again. Like you're not a failure, basically. There's people, there's support. Brittany's saying she asked for antivirals and they didn't give them to me. Okay, so that's a really big thing that I talk about too, is to be your own advocate. This is your body. And, like Jodi was just saying, a lot of medical professionals out there are not super educated in the field of Bell's palsy, Ramsay Hunt, all the causes. And that's okay, because they don't have, they're GPs. They have, a little bit of knowledge in everything, and they're amazing people. Go see somebody else. Because the reason why I do love this book, and I recommend it to everybody that contacts me that has first onset, is this is 5 doctors in one book. This isn't just one doctor's, opinion or point of view or anything. it's 5 that have experience, and that's unheard of. I haven't seen another book like that. So that's where I do recommend that. I think you take, like Jodi was saying, take it to the doctor, even if it's been a while. You know, if it is, but like obviously for myself, it's been 6 years, too late for the antivirals or whatever. But this book has so much information about when you're first onset, about living with it, about everything. So as I always do, I'll post the links in the comments, but never be afraid to go get another opinion. This is your body. It's your face, for crying out loud. So get out there. And I did a post about this last week. If you don't feel strong enough to ask for another opinion, bring somebody who will. Bring your mom, bring your sister, bring your cousin, bring your friend who says, hey, no, we're going to go get this checked out, because what's the worst that's going to happen?
Right.
You're in the same position you were in before, right? So,
right.
So that's what I just wanted to say, got on that ramble about that girl there. Now, I just wanted, so we just wanted to say again, we have about 30 people on our live call right now. I'm super excited. I feel like Jodi, you and I could talk for about 8 years, because I am like so passionate about this. I'm so excited to know you are as well. I definitely will be booking some appointments with you, because
that would be great.
I'm so excited to learn about it, and maybe we'll video them and, you know, maybe take through my followers through my experience, because I am very passionate too. I think that, you know, you first get your diagnosis, and for those who recover fully, whew, amazing. So grateful that you do that. But there's so many people who don't, and that's where we kind of stick. That I want to have an advocacy for self-care. You know, we deserve it. Try again, you know.
Right.
So I definitely will be booking some virtual appointments with Jodi. I will be posting all the links below of everything that we talked about, of course, to the book. I'll post some information about the Blinkies that Jodi was talking about. I know I saw quite a few questions about where to get those. Just a reminder, you do need a prescription, Jodi said. So you do either need to make an appointment with them or take the information to your doctor. I'll post the links for those. And of course, we'll post the information to get a hold of Jodi and her team if you would like to book some appointments or find out some more information about those videos. So we are going to have to say goodbye, because it's been 45 minutes. And like I said,
we really could talk days about this. I mean, it's just so fabulous. I mean, you know, the patients who have facial palsy like you are a wealth of knowledge. And so if we combine my knowledge and your knowledge, I really think we could continue just improving on the care. So, you know,
I'm like just using even like, and me listening, I mean, this is amazing. Like 5-6 years ago, the only research that I had was causes and Louise Hay, who I love, like looking into the medical physical reasons why things happen. Absolutely, 100%. And my mom saw on a show somewhere some facial surgeon that was going to cost $30,000, and I didn't know whether it was going to make any difference. So it's literally the things that I was working with. So it's very important to me, and obviously you, and you're an amazing human. We want to make people, you guys, listeners, viewers, whether you've had Bell's palsy, Ramsay Hunt or not, self-care is important. Standing up for yourself is important. Finding out information. This is your body. So that is my passion too, is creating somewhere where people feel like they belong and can contribute. And I'm really excited about that, because I feel like we got a lot of things that we can make a difference with.
Well, I thank you for this opportunity. Really.
Anytime. I'm you know, our schedules are crazy, but once we get it figured out, we will. I know my followers are going to want to chat with you more often, so we'll definitely get that arranged. Like I said, I'm going to book some appointments, and I can't wait to more and speak more with you and be more involved in your foundation and your efforts, because
that'd be great. All right. Thanks, Barbie,
for joining us, and we will talk to you soon, and you have a wonderful day. Thanks again.
You too. Take care. Bye.